with our fixed indemnity plan, what's new, what's changing, and why? So, if we think about if we only had a choice between two things, we know it's easier to know what option we might prefer because it's easier for us to weigh the pros and cons. So when the number of choices increases, so does the difficulty of knowing which is best. So we kind of approached this change from the power of three stance, and that paradox of choice. Brokers and clients shared concerns and feedback about what their desires and needs were to have a stronger and a more enhanced portfolio of products with Health Protector Guard. So during this process, we determined that we did need to increase different benefit levels to give stronger coverage. We needed to remove waiting periods on wellness and preventive. We also needed to add some benefits and limits just really to provide a more positive coverage effectiveness, and I think most importantly, creating a better overall buying experience for your consumer. So I just want to kind of highlight a few things. I'm not going to go through everything that's on here. I will get this over to Benavest and they can share with you. But I did want to highlight kind of the first five things on here because based off of discussions I have with brokers and questions that are brought to me, I feel that these are probably five things that are going to be most relatable and very beneficial for brokers when they're selling and clients when they're buying. So we have 12 plans in our current portfolio today. Starting tomorrow, you are going to see a change that those number of plans are going to go down to three. Again, we talk about that power of three and making that the ability of choice a lot more simple for your clients. I mentioned no more waiting period on wellness. So we are eliminating the 30-day wait on preventive and wellness. We also, based off of client feedback, are increasing the colonoscopy and mammogram benefits on this plan. And then we're also going to increase the number of office visits on our mid and high level plans. So as I mentioned, we are going to have three plans. We categorize them as low, mid, and high plans. And you'll see our marketing department got very creative. Our low plan name is called Select 2000. Our mid plan name is Preferred 4000. And our high plan is called Premier 5000. So on our preferred plan, we are enhancing the inpatient confinement benefit today. It is currently at a $3,000 a day benefit, but starting tomorrow, that benefit is going to be increasing up to $4,000. So you will have choices when you're working with clients to offer them the $2,000, $4,000, or $5,000 per day benefits. ICU is also receiving a makeover. So previously, we did limit that on all of our plans to 31 days. Based off of client and broker feedback, we knew that was not enough, and we did need to make a change so that as of tomorrow will be increasing to 60 days. And then the emergency room benefit also needed an enhancement as well. Previously, we provided for one ER benefit, so one instance. This is increasing to three. So now your client will have three instances available for that emergency room benefit. Now, when it comes to the surgical portion of the fixed indemnity or Health Protector Guard plan, in a couple of slides, we'll get into specifically what the different tiers are. But I do want to call out some things here that are different parts of the surgical portion of the plan, including the outpatient facility. So on our high plan, that Premier 5000, on our plans currently today, we were offering it's a $2,500 benefit for 3 days. Again, based on client and broker feedback, that was not sufficient enough. So on that plan, we're going to give an option now at $4,000 per day. Again, this is for that outpatient facility benefit, and will now allow for 10 days on that versus the old on 3. We're also enhancing the outpatient diagnostic and imaging, the tier 2 imaging of that. That's going to include items such as your MRIs, your PET scans, CAT scans, and this is going to be an amount per test. On our plans today, we offered $300, $400, or $500. that is now going to be enhanced up to $400 or $1,000. So a nice increase on that tier 2 imaging as well. And then oral chemotherapy, we're actually doubling the benefit on this. We used to offer $1,000 a month for up to 3 months. We now will pay a benefit of $2,000 a month for up to 6 months. So a nice enhancement for the oral chemotherapy. And then when we talk about the outpatient chemo, radiation, immunotherapy, and the non-oral treatments, we're going to be enhancing benefits on that high plan. Again, that Premier 5,000 is going to go up to $2,500 per day, and we're going to now allow 60 days instead of 40 days. So again, $2,500 per day for that outpatient chemo, radiation, and immunotherapy. If you recall on one of the first slides, I did mention that based off of NPS scores and broker feedback, we are eliminating the 30-day waiting period on the wellness and preventive benefits. So these benefits will be available day one. And we're making quite a few increases on several different items within this wellness or preventive category. We're increasing the wellness exam benefit on all of the plans, the diagnostic labs, the health screening x-rays. And then I did mention specifically mammograms and colonoscopies. These were two things that we found based off of NPS scores and broker feedback. We needed to increase that benefit. So in relation to mammograms on all the low, mid, and high plans, as it is today, we were offering $100 or a $500 benefit in year one for a mammogram. So starting tomorrow, that mammogram benefit is now going to either be $200 or $300 in year one. And then you'll see